All right, let's talk about Arestin. So remember, Arestin is your minocycline. So 1 milligram of minocycline is your Arestin dose, okay? So you need to make sure when you do this, this is one of the 3 things that you have to have a DDS sign off on. So they DDS us to sign off because it is a medication. All right. So when the DDS comes over, and you need to give them your rationale for why you want to do your Arestin on your patient, you have to give them 2 things. So at least a 5 millimeter pocket, so 5 millimeters or more, and then bleeding and probing. So those are your 2 things. When the DDS comes over, you need to tell them that. You'll be good to go. So you need to have your patient sign a treatment plan. The Arestin, just like the hypersensitivity, is treatment plan per location. So remember that the Arestin is done kind of like your probing depths. So when you do your probing depths, you've got 6 different sites per tooth. And so it's the same thing with Arestin. So you would do your Arestin, let's say, on the mesiolingual of number 14, mesial buccal, whatever. Okay, so that's your location, so that's your dose. So more often than not, probably 99% of the time, you're just doing 1 dose because we don't really have a whole lot of this for each student to do more than 1 or 2. So, all right, so DDS approval, contraindications, very important for this one. So if your patient has a tetracycline allergy, which you should already know about that, and then women, if they are pregnant or nursing, because of the effect that it can have in developing teeth. So I know children is on here, but likelihood of us doing needing to do Arestin on a child is very unlikely. So, all right. So when you do this, again, like your hypersensitivity, subgingival irrigation, this is going to be after you do your treatment. So you're going to do your perio maintenance, you're going to polish, you're going to floss, then you're going to do your Arestin. All right. This is most often done at the 6-week reevaluation or the perio maintenance appointment. This is not done after you do an SRP quad. So again, so you're going to get your dose of Arestin, and then this is your syringe that you're going to use. Remember, this looks a lot like your LA syringe, but it doesn't have, it's a different top, obviously. So you're going to put this on until it kind of snaps in there. Just kind of put it in there, and then it kind of snaps in there, okay? To remove it, you're going to pull back on here. It pops right out, okay? All right, so when you put that on, all right, so then you've got your little cap in here. Cap comes off. So I didn't really show you guys very clearly the other day how to kind of thin this out, because remember, this is a circle. It's kind of like your probe, so it might be a little uncomfortable going into those pocket areas. It might not matter how big it is because some of these pockets are so big, but let's just take a little bit of closer look to see. I don't really have anything. Oh, here, I'm going to use my coaster that I use for pop and stuff. So you're going to lay it flat on there. You're going to take like your cotton forceps, take the handle, and you're just going to press on it until it kind of flattens out a little bit. A little bit might come out, obviously, right there. Anyway, and you probably can't see it too well in this. It actually didn't make much of a difference, but it does make it a little bit flatter and a little bit more comfortable for your patient. So, all right, so we're going to go to our tooth. So I'm going to be right here on number 14. We're going to do the mesial buccal location. So you're going to go in there just like you're probing. Okay, go in. If you can get in there. Go into the base of the pocket. You're going to retract about 1 millimeter, a very small amount. And then, let's get it in there first. Get in there and then push down. And then it'll all come out. Okay, so get down into the base of the pocket. Retract a little bit and go ahead and dispense. And then you're going to take your probe and you're just going to take it and kind of push that stuff back in there. You can't really get a whole lot, but you try to push as much stuff back in there as you can. Okay. All right. So that's your Arestin. Make sure you're familiar with your post-op instructions and what you need to document.